Hi, and welcome to another edition of the Trustcast Show. And we're really happy to have with us today Dr. Brandy Hauck. Welcome to the show, Brandy.
Thank you so much for having me. It's great to be here.
Brandy is a clinical child psychologist who co-created a therapy called PC Care that turns around the parent-child relationship in just 7 sessions. And she built it from scratch after studying children who grew up in Russian orphanages. So, Brandy, take me back to those orphanages for a second. What did you see in those kids that made you think, I have to build something that fixes this at the root? Or was that your thought process?
Yeah, that's such a great question. So, first, I have to give all of the honor and respect to my advisors, Dr. Bob McCall and Dr. Christina Groark, who were the PIs on the project, the principal investigators on the project that I worked with in Russia. They had spent a long time going into what are called baby homes. So, in Russia, the
Hmm.
homes for 0 to 4-year-olds are called baby homes. And they had gone in and developed interventions. And so by the time that I was able to actually go to Russia to see the baby homes, we were years into the research study. And so there's 3 baby homes that we visited. The
So before we go
Yeah,
further, because this is
of
going to be,
course.
this is interesting to me. So I have my list of questions, and I always have a big list of questions, and I get to some of them, but a lot of them just come as we're going because it evokes curiosity. So explain that concept of baby homes in Russia.
Yeah, so the general consensus was it's not useful to raise somebody who has a significant disability because they're not going to be able to be as helpful to your family and they take a lot of energy and time. And so they were sent to baby homes. And so
So let me
yeah,
unpack that a
please.
little bit because
Yeah.
this is kind of foreign to us in the U.S. I think it's foreign to most people in the
Yeah.
U.S. and really in most of probably in Europe too. So you say it's not useful. Well, so is it socially acceptable then if you're pregnant and their child is has a disability, the child is born and has some kind of disability, whether it's mental or physical or whatever, than to just give up that baby?
Yeah, actually. And I do need to say that I visited these homes, and so what I'm talking about is really from the early 2000s, the early 2010s. So it is possible that things are vastly different now. So I want to make that clear. I don't know what's happening right now. But yes, at that time it was very socially acceptable to relinquish your child to a baby home.
Well, we could almost just spend a whole hour on that, but
Yeah.
I don't want to digress there. It's such an interesting thing to me that and the concept is revolting and interesting, like stopping at an auto accident.
Yeah.
So continue on. So you'd go to these baby homes and then tell me the rest of the story here.
Yeah, so there's 3 homes in the study. The first is a standard no intervention. The thing about the baby homes in the Russian Federation is that they were directed by pediatricians. And so
Hmm.
the medical care in the homes was great. The nutrition was great. The whole physical nature of the homes was as good as you could expect and as good as you could want. But the caregiver child interactions were incredibly deprived. They're called socially emotionally depriving institutions because of that. So the kids would see 60 to 100 different caregivers within their first 2 years at the baby home. Think about that. It is a new caregiver every single day. They would never
Wow.
see the same caregiver on 2 consecutive days.
How
They
big were these
spent
places?
um pretty big. I mean, it's for 0 to 4-year-olds. There were usually maybe 3 to 4 rooms per age group. So you'd have like a 0 to 1-year-old age group, a 1 to 2s, 2s to 3s, and 4s to 5s, or 3 to 4s. So it wasn't small. They're pretty big buildings. the kids were just sort of in their rooms and they're not interacting with the caregivers.
Hmm.
The caregivers were sitting over having tea and talking to each other and like making sure that the kids are safe, but not playing with the kids, not engaging with them, um, which you can imagine would not be very good for a child.
Yeah. Yeah. So your study, so you said you had different types of these homes. How were they
Yeah.
different?
So there's the no intervention, and then there was a home called training only, where they trained the caregivers to be more sensitive and responsive, how to play with kids, basically. And then a third baby home where they did that training as well as made structural changes to create smaller family units, to create primary caregivers. So the kids always had one of their two primary caregivers with them. They adjusted the schedules so that the people were there on consecutive days, so that there was just more consistency. And
Hmm.
what we found is that in the homes where we created sensitivity and consistency, the kids' communication skills, their cognitive skills, their language skills, their personal, interpersonal skills all improved over time
So I want to
versus
make a
got
comment
worse.
here. So
Yeah.
my comment is that my personal observation is that's not really surprising, is it? Oh, I mean, that wasn't a surprising
No.
discovery. It was like you're just documenting the facts, almost like you're gonna. Is this something that you shared with the Russian Federation, and you hope that they would maybe change?
Yeah. So again, my advisor, I was a graduate student as I was
Right.
doing this, so I
Okay.
really can't take credit for much of it. But my advisors, and we had colleagues at the University of St. Petersburg. So we had Russian colleagues that were intimately involved in this project, and they would go to the staff at the other baby homes and say, look at the results. And overwhelmingly, the response was, I don't believe it. What we're doing is best.
Wow.
And so even the baby homes that were involved in the study, so the no intervention and the training only home, when the study was over, they went back to those homes and said, "Look at the differences. This is the data. Do you want us to do the same? Like we will give you the training. We will help you make these structural changes." And the directors in both of the homes said, "No, what we're doing is better."
Wow. Scary, weird,
Yeah.
weird to, I mean, anybody who's watching this, they're going to think that's weird, almost like so weird, it's almost unbelievable. But it just different culture, you think it's the same, but I guess it's not the same. So, okay, so you take this, now continue on. So, how did that help you develop this therapy called PC care? What did you take out of that insight to make this new therapy that you've developed?
Yeah, so really coming back to that idea of sensitivity and consistency. And what you'll see if you research infant mental health or anything related to young children is that um, there's two incredibly important things for young kids: sensitivity and consistency from their
Hmm.
caregivers. And so we took that in creating PC Care. And I co-developed PC Care with two amazing colleagues, Susan Timmer and Lindsay Armendariz. And so we had been PCIT, parent-child interaction therapy trainers, which is another parenting intervention. And so we took some really crucial, very effective components of that, which include coaching parents. So practicing in the moment the skills that you're teaching, and changed some things and made this program that's short. So most parenting interventions are a lot longer. This one's only 7 weeks long. And we focused on sensitivity and consistency, developing warmth in relationships, developing more consistent and sensitive communication styles, developing some skills for relaxation and regulation, and then consistency, helping parents develop structure and behavior management in their home so that they can be warm, be loving, be caring, and be structured for their children.
Structured is another word for that was strict when I was growing up, but um, But I guess that's maybe a too restrictive of a word. So, so if my kid's melting down constantly and nothing I try is working, is that a parenting problem, a child problem, or something else?
How could it ever be anything but both? If your child is melting down and you can't support them, you can't help them, then there's three things at play. There's the child and what's going on in their body and what they need. There's the parent and what's going on in your mind and in your body and how you're interpreting events. And there's the relationship, how you two are able to use each other to regulate. And so it's never just one, it's always all three of those things.
Okay. So what is the third thing? So I think the parent, the child, and then
Their
the
relationship.
their relationship. Okay.
Yeah.
So how do I even know if my child is doing it, what they're doing is a phase or something that actually needs some sort of professional intervention?
Yeah, so if your 3-year-old is tantruming, congratulations, you have a normal 3-year-old. They all do that, right? Because your
Doesn't
child
feel like it at the
tantrums.
time, though, does it?
It does not. It does not feel like it at the time, but it's totally normal. Like you are not the first parent that's going through this. You won't be the last. When your child's behaviors start to interfere with you doing normal family things, with them doing normal school things, with them having fun with their friends, right? When the behaviors get in the way of doing life, that's when you should seek help.
So, what's the fastest sign that a child is struggling emotionally and parents tend to miss?
Oh, this actually is a great question. I would say the sign that parents miss most is when their children are really, really good and perfect and never
Mm-hmm.
make mistakes. That
So,
is
explain that.
concerning.
Explain that. There's certain there's certain cultures where they embrace that thought process. So tell me what's going on behind the scenes of the perfect child.
Yeah, well, as a recovering people pleaser myself, let me tell you, there's a lot going on behind that. So when I hear about kids who never have any difficult behaviors, who are really like quote unquote perfect kids, they're the easiest child, I get concerned because a child's job is to push boundaries. A child's job is to go out in the world and explore and be a little messy and do things that are a little bit dangerous to see what they can and can't do. And so if a child isn't taking chances, if a child isn't getting messy, if they're not doing something a little dangerous, if they're not getting in trouble every once in a while, then that means that they are over controlled. They are working really, really hard to maintain this facade of perfection and being good. And that actually takes a lot of work, and it's often indicative of some anxiety symptoms.
So my child went through something scary, a divorce, a move, a loss, and now their behavior has completely changed. What's actually happening inside that kid?
Yeah, so they've experienced a stressful event. They might have experienced a traumatic event, but they definitely experienced a stressful event. And when we experience stressful events, our bodies respond to that. Our body says something is not the same, something scary is happening, and so I need to adjust to the way that I interact with the world in order to be able to manage this new scary thing. And so their nervous system gets changed. They might be sort of constantly on edge, waiting for the next scary or stressful thing to happen, or they might be really dampened and sort of not moving around at all, really quiet, maybe withdrawn because they're also trying to protect themselves from the next scary thing. They might start to have trouble concentrating, or they might not follow directions because they forget about it because their mind is thinking, thinking, thinking about all the scary things that happened. And so they don't have capacity to focus on something else or to remember to pick up their clothes the way that they used to remember to do that.
So at what age should a parent be worried that the window to fix that parent-child relationship is closing? Or is there an age where they're getting too old and to repair whatever is going on? Is there a window?
So it's an interesting question, and the answer is yes and no. So, in general, I would always say it's never too late to start trying to make a change, right? It's never too late to heal. It's when we start to think, oh, it's too late, and we give up that things get worse. So if your child is 17, it's not too late. If your child is 10, it's not too late. If your child is 39, it's not too late, right? You can always try, you can always start fresh. Now, we also know that the earlier that you make changes, the more profound of an impact it will have. And so 0 to 5, the years from 0 to 5, we're developing 90% of our brain. We are developing our patterns for interacting with the world. We're developing our core understanding of ourself and others and all of these things. And so intervening during that period of time is where you're going to have the most profound effects, but it's never too late.
So if a parent loves their child, but they really don't like being around them right now, can a therapist help, actually help with something like that, that thought process? But there's probably even some guilt going in the parents' head, but they just can't stand to be around their kids right at this moment. The behavior, or maybe it's partly the parent, partly the child. Can therapy help with something like that?
Absolutely. 100%.
So can you give me an example that where you've dealt with a situation like that?
Yeah. So if we're thinking PC care, so PC care can help with this. A lot of what we do is help parents play with their kids. And when a parent doesn't like their child, that's a struggle at first. But through the PC care skills, through coaching, through consistent practice playing with their child, we can start to help them enjoy their child. They have this little period of time where everyone's on their best behavior, where they can delight and see how creative their kid is, that they can be like, oh my gosh, like, I didn't know you were so cool. You actually are pretty cool. And that period of play is so important for being able to find that like. For older kids, right, sometimes I work individually with the parents to help them with their own thought processes. So, what's going on in your head when this happens? Where does that thought come from? Let's, really process what's going on for you so that you can distance yourself from your child's behaviors. And then sometimes there's family therapy that we'll do with older kids and their parents um, to again help them communicate better so that they can like each other a little bit more.
So, family therapy. I remember that we had at, at least there was 4 kids in our family, and we did go to family therapy once, and I'd say our family was sort of dysfunctional, but I don't know any family that is really functional. If I think every family is dysfunctional. As I've gotten older, I've come to sort of understand that. But I know that, and at least in our situation, it caused a lot of conflict at the therapy, and we ended up giving up, almost right away. Do you see this, or how do you deal with that? Because I can see that that was what happened with us. Probably happens. How does PC care help to deal with that?
Yeah. So in PC care specifically, we have a progression of skills that helps with that. So in the very beginning, in the first session, we're teaching skills for positive communication and to make it easier for your child to have positive behaviors and make good choices. And so we're not starting with the conflict. We're actually starting with the easy, which is actually really hard for a lot of parents, of
Hmm.
just being with your child and playing with them and being kind to each other and not focusing on the problems. And then we add skills session by session until we get towards the end to skills of following directions and what to do when your child doesn't follow directions, which is where most of the anger and frustration lies. But we've built up this positive relationship before we jump into the hard stuff.
So walk me through what happens though. So I think you did a little bit, but I had this question down here. I wanted to understand what happens when a family comes through the door at PC Care, but I think you just did that. So 7 sessions sounds almost too short.
Mhm.
Why does this work in such little time? Because usually when you're talking about that sort of therapeutic sessions, they're talking a year or, a long time. So how is it this different where you can get an effect in that short a period of time?
Yeah, it's a great question. And it's a question that we had to ask ourselves when we were starting. And it actually comes from my colleague Susan Timmer's research into PCIT and other parenting interventions, where she found that the most gains happen in the first 7 weeks of other interventions, even though they continue on past those 7 weeks. The largest gains happen in that period of time. And so we took that and then we wanted to work through that because 7 weeks is also when a lot of people start dropping out of parenting interventions because it gets long. And
Hmm.
so we wanted something that people could actually finish because finishing something gives you a sense of accomplishment. It makes you feel good about what you did. It also means that they're going to actually receive all of the skills. They'll have a chance to learn everything and they won't miss out on what comes after they drop out. And so the fact that we do new skills every week, that parents are looking forward to learning something new next week and trying it out, and the fact that we actively practice in session. So we spend about 20 minutes with the parent and child playing together or doing an activity together, and we are actively coaching the parent, say this, do this. Notice how your child responds when you do that so that the parent can see, oh, this works. And when you see that something works in front of you, you are much more likely to actually do it at home
Hmm.
versus someone telling you this will work. You may or may not believe them and you may or may not do it at home.
So break out for me what are the 7 fundamental blocks that you deal with in PC Care?
Yeah, so the first session is pre-treatment. So we do an assessment of the parent and child, and then we provide some psychoeducation about why children have challenging behaviors. We talk about things like temperament, we talk about family cycles, we talk about scaffolding and emotion regulation development, trauma, autism, whatever is happening, right? That is leading to these difficulties. Then in the first coaching session, like I said, we'll teach positive communication and we teach about how to adjust your environment to make it easier for your child to make good choices. In the second session, so session 2 of coaching, we teach regulation. We practice regulation skills. We practice strategic attention and modeling and redirecting, ways to use your actions and your attention to show your child how to behave. And then in the third coaching session, we do rules, how to do effective rules, which most families, myself included from time to time, we don't actually give rules effectively. And so
Hmm.
helping parents really figure that out, using things like when then statements or choices to help your child know how to make a wise choice. And then in the fourth coaching session, we're talking commands and consequences, what to do if your child does not follow directions. In session 5, we're talking about redos, how to make mistakes and correct our mistakes, recovery, how to return to the relationship after something difficult happens. And then in session 6, we put it all together and talk about what's working best for the family.
And what about session seven? Or wasn't there
Oh,
seven?
yeah, it's because pre-treatment is really like session point
One,
one,
but
right? Point
okay, I
five.
got it. I got it. I got it. I got it. So, what happens when you have one parent who's all in on this concept and then the other parent doesn't really even think therapy is needed? And do you have that situation? What do you do?
Oh, never, never. Of course, this happens all the time. It's so common. My favorite is when both parents come in and they're both invested. But it happens a lot that one parent will come in and they say the other parent doesn't want to do this. The other parent might be actively working against it. They might be telling the parent that's coming in that what they're doing is dumb or that it's not helpful. And in those situations, all you can do is work with what you've got. And if you have one parent who wants to make changes, then you have one parent who wants to make changes. And yes, things will be faster, things will be easier if both parents are on the same page, but you can make progress even if only one parent is willing to change.
So, do you have this available? So, tell me where you're located.
I'm in Sacramento, California.
Okay, I like Sacramento. So,
Thanks.
can you tell me if you're not in Sacramento and then this all makes sense to you, then how would you get help? I mean, other than driving to Sacramento, or can't do you operate some sort of form of this remotely, or is it just you offer this in Sacramento and you're location based?
Yeah, we actually do offer it remotely. So the one of the cool things about PC Care is that someone who is a licensed mental health professional like myself can offer it as therapy, but also non-licensed individuals or what we would call paraprofessionals can be fully trained and offer this as more of a parent coaching intervention. And so I'm the CEO of Red Leaf Psychology, which is a private practice in Sacramento. And I do PC care in therapy, but I also work with my colleague and co-developer, Lindsay Armendariz, who is not a licensed practitioner. She has her master's degree in human development, did this, and she offers parent coaching. And so I can only see people in California because of licensing laws, right?
Hmm.
But she's able to work virtually with people from anywhere. We also will start offering parenting classes where we'll teach the PC care skills to parents and from anywhere who want to join. It won't be therapy and it won't be individualized in the same way, but you can still learn the skills from us and talk with us and consult with us about what's going on. If you're a therapist and you want to get trained, we have trainings coming up. Our next one will be in August in San Francisco, but we'll be doing more. We do trainings for professionals all the time. And we've trained people across the country. So hopefully there is a provider in your area.
So, I people always like to hear stories about someone who's done something and had some sort of success. Can you tell me like about an individual where they were surprised at what the results that they got?
I mean, yeah, everyone. Um, I've, you know, I have so many stories that I could share. I think that I would like to share a story from a project that that I managed working with children in the foster system. And we had a child who was coming to PC care with their foster parent. This was within the first 90 days of placement. I think they'd been there for about a month. It was a little girl, and a little girl had been sexually abused previously, and she's now living with a resource or foster father and a foster mom. And she was terrified of her foster father for very good reason, right?
Hmm.
It made sense that she was terrified of him, but he was feeling so bad about how afraid she was, that he was close to saying, this isn't going to work. He was very close to having to put in their 14-day notice and have the children removed because he just felt so terrible about being so scary to this little
Hmm.
girl. They did PC care, and at the end, she was playing with him. She was coming over to him for age appropriate hugs, right? The kind of care that you want to see between a foster parent and a child. She
Hmm.
was laughing with him. They had a beautiful, wonderful relationship. And he and his wife had requested to move into adoption with these girls.
Wow, that's fantastic. So, if I'm reading on here, I have some more questions, but we're running lower on time. So, you spent years working with foster kids in Sacramento who were moving placements at alarming rates. What was causing that, and what changed when PC care was introduced?
Yeah, I guess I will say it is alarming rates, and it's not unique to Sacramento. Children in the foster care system in the United States change placements at alarming rates. And there's a lot of reasons for that. Some of those reasons are structural. So CPS is working to find kinship placements. So these are things like siblings, grandparents, aunts, uncles. And if they find a kinship placement, they automatically move the kids. So sometimes it's that structure. But
Hmm.
the most concerning placement changes are the 7-day notices or 14-day notices where the foster parent says this child's behavior is too much. I can't handle it. They have to go somewhere else. And there's a terrible cycle when that happens that children with disruptive behaviors are difficult for their foster parents. The foster parents then put in a placement change. The child changes placements. They have another stressor. They have to learn new rules. They're more overwhelmed, and so they have more difficult behaviors. And so they just keep changing placements and not getting help. So PC Care was implemented in Sacramento during the first 90 days of placement for kids in order to stop that cycle. And we really did. It was kind of amazing. The children who went through PC Care were much more likely to be in the same foster home 6 months later than the children who did not. And a lot of it is like the story that I told you, where parents were saying, okay, it's actually a lot easier to manage this child now. I feel closer to this child. I feel like I have the skills and support to be the best parent that I can for this child.
I think it's a great story. So, how does somebody get in touch with you, whether it's a parent if they're in Sacramento, or um, if they're a provider somewhere else and they're interested in PC care? What's the best way to get in touch with you to find out more about what you're doing?
They can go to our website, redleafpsychology.com. They can also email us directly, info@redleafpsych.com. And I can send you all this information so that you can put it um, in the description for folks.
Yep.
And then the part of my job that we didn't talk about is that I'm also a podcast host. We have
Okay.
the Nerdy Psychologist Book Club, where we talk about fantasy and dystopian books and psychology concepts within them. And we're on all the social media platforms. So if you want to reach out through Instagram, TikTok, Facebook, you can find us at the Nerdy Psychologist Book Club.
I like the name too.
Thanks.
Okay, thanks so much for coming on, Brandy. I really appreciate it.
Thank you.